Atrial fibrillation, or Afib, is the most common type of heart arrhythmia, and the number of people diagnosed with Afib is increasing both in the U.S. and worldwide. Left untreated, Afib significantly increases the risk of heart failure and stroke. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. During Heart Month, we're talking about Afib, the recent changes in guidelines, and how St. Luke's is leading the way in innovative treatments for those who have Afib. With me today is Sanjaya Gupta, a cardiologist at St. Luke's Mid-America Heart Institute. Thank you so much for joining us.
Thank you.
Well, Dr. Gupta, what is atrial fibrillation and why is it important to manage the condition once you're diagnosed?
Sure. So Afib is a rapid, irregular heartbeat from the top part of the heart. It can cause symptoms of fatigue and shortness of breath, but it also significantly increases risk of stroke and heart failure, as you mentioned. It's the most common heart rhythm antibody in the world, affecting about 2% of the world population, but up to about 10% of people above age 70.
Okay, wow. And late last year, new guidelines for diagnosing and managing Afib were released. Can you give us some of the highlights about these updates?
Yeah, this is the first really comprehensive update for our guidelines in about 9 years. It really covers a lot of the science that's come up in several years and really helps very practical advice on treatment of Afib. One of the new concepts that's come out is recognizing that Afib is a progressive disease that goes through stages.
Okay, so tell me more about these stages.
So what's a new concept for us is this stage 1, which is actually someone who doesn't have Afib, but they have risk factors for developing Afib. And that's an important thing to recognize and time to intervene. Then after they're diagnosed, the first stage is called paroxysmal Afib, where they go back and forth in and out of Afib. As the disease progresses, it goes into persistent Afib, where they're stuck in the rhythm for periods of time. And then finally, eventually, if left untreated, they develop permanent Afib, which the heart can only be in Afib and can't get back to its own rhythm.
Okay, so are there any warning signs or symptoms that someone might have Afib?
Yeah, great question. So what's interesting about Afib is about half the people can feel it and then half can't. And even among those who feel it, the symptoms can be somewhat vague. Some people can feel the heart racing, but other people may just know that they just feel more tired or have less stamina. Some people just say, I just know I just wasn't right.
Right. Okay, interesting. Now, with these new guidelines, what are some lifestyle changes that are now recommended to prevent or reduce Afib?
Yeah, these are, I think, some of the best things to come out of these guidelines, some really practical advice. So one of the big ones is weight loss, having people to really focus on losing about 10% of their body weight significantly reduces your risk of Afib. Another thing is recognizing having high blood pressure, so trying to get that as close to 120/80 as possible. Also, exercise is really helpful in trying to get that on average, about 210 minutes of exercise a week. Alcohol is another risk factor for Afib, and trying to limit your alcohol consumption to 3 drinks or less per week. And then also recognizing sleep apnea is a major risk factor for Afib as well, too.
Okay, great. All good tips. Now, recently, you and other cardiologists here at St. Luke's were the first in Kansas and Missouri to participate in a clinical trial for a novel treatment for Afib, which was also recently FDA approved. What makes pulse field ablation treatment a game changer for Afib?
We're really excited about this. And so up till now, we've always thought of ablation as either burning or freezing. And the problem with that is that while we target the heart tissue, we can a lot of times cause collateral damage structures next to the heart, like the esophagus and airways and arteries and nerves. What pulse field ablation is that's different is it's a non-thermal form of ablation. It gives out pulses of electrical fields, pulse of electrical activity that will disrupt the cell membranes, and doing so just affects the heart muscle without anything else around it. So it's a real improvement in both the safety as well as the efficacy of this treatment.
Great. Wow, that's fascinating. Well, is there anything else you'd like to add?
Just that people are becoming more aware of Afib, and if you feel something is not right, or if you have one of these devices that a lot of people have that will tell you that you're out of rhythm, please make an appointment to talk to your doctor to discuss treatment options.
Okay, well, congrats on leading the way for these innovative treatments. Very exciting. To learn more about Afib and the treatment options at St. Luke's, visit stlukeskc.org/Afib. You can also find updates on other health news at stlukeskc.org/news. Thanks again for watching. We'll see you next time.